Hello, everyone, and welcome back to Freely Nourished, the podcast that empowers you to break the cycle of dieting by teaching you to nourish your body well. I am your host, registered dietitian Erin Casey, and I am also the owner of New You Nutrition Counseling, where we believe that you can reach all of your health goals at just about any body size, and that nourishment and inclusion rather than restriction is the key to ultimate health. I have some exciting news to share for you all. Hopefully, by the time this podcast airs, I will have opened up registration for my holiday accountability group coaching program. So, this is kind of a soft launch program to our New Year, New You program that will start running at the beginning of January. But this program, the holiday season support group, is basically for anyone who just needs exactly that, a little bit of extra support with their health, with their nutrition, staying on track with their goals, etc., throughout the holiday season. Now, I want to be clear that those of you who have been around for a while know this, but those of you who are new may not. We are not about restriction here. So you will not find things like diet advice or ways to restrict or bend the rules or things like that around the holidays. We will not be talking about weight loss throughout the holidays. We all overeat through the holidays. That is okay. Weight loss for many of us is not a realistic goal, although it can be in some situations. But we will be talking more along the lines of things like you are going to be eating foods that you don't normally eat, that may or may not create some anxiety for you. So we'll be talking kind of how to navigate some of those emotions. We also all tend to interact with people who maybe we don't see throughout the rest of the year, either intentionally or unintentionally. But as we all know, diet culture is very toxic, and it kind of just sinks its little tentacles into just about every asset of our lives. So holiday gatherings are no exception. So you may be somebody who kind of intentionally draws boundaries around certain people or certain conversations throughout most of the year, but then kind of as the holiday season picks up, there's more and more either social gatherings, family gatherings, etc., and you are just finding yourself faced with more conversations that you don't want to have. So we will talk through kind of one, how to navigate some of those conversations, and we will also be talking about kind of how to set some healthful boundaries in the midst of the holiday season. And then, of course, we'll kind of talk about some of the standard things. So things like, if you're traveling, kind of how to stay on track with your goals. Again, it's not about restriction, but it's more of like, okay, how do I make sure that I'm getting enough fiber so that, my GI system's not completely torn apart from traveling or eating differently. What are some ways that I can move my body if I don't have, my normal access to the gym, or just intentionally taking some time off from it, things like that. So kind of ways to kind of stay on track and keep yourself well nourished throughout the holiday season. So it will be a 12 weeks. We will begin the week kind of right before Halloween, and then kind of go right through the holiday season up until the end of December. It is a flat fee of $90. And with that $90, you will actually get a discounted price. And by discounted, I mean half off, right? So the course that is launching in January will be about $180. So you will actually get that same course at half price. So basically, how I view this is that you guys are kind of participating in a soft launch for me. Those $90 can kind of count towards the upcoming course, should you want to be a part of it as well. So you actually are kind of getting a 2-for-1 deal almost here. So $90 upfront. You also will get, if you do choose to be part of this holiday support group, you will also receive a significant discount, as in half off of the New Year, New You course, which is launching in January. There will be basically weekly meetings and kind of homework assignments. That's largely how we're going to do it. So how those meetings will run, they'll be about an hour. They will be recorded. So one, you will have to consent to having it recorded. It will be on a Zoom call. You do not have to have your camera showing. The chat, nothing like that, will be published online. But basically, and the only people who ever have access to those recordings are other folks who have signed up for the same program. So this isn't something that I'm going to post on TikTok or social media or anything like that. It is very much just going to be available solely to folks who are participating in this course. but they will be recorded. So if you can't make the meeting time, obviously, once we kind of have our little cohort together, we will collectively decide at the best meeting time that works for most people. There still will be people who either just can't make that meeting time, or there will be people who, incidentally can't make the meeting, but you will still have access to the content. And then I will basically design kind of a whole little kind of support accountability guide that you will work through week by week as well. So, the structure of the calls will be, we'll kind of go through a couple of activities together. We'll kind of talk through some of what the homework assignments are. And those things are really meant, they're for you, right? They're for you. They're how, kind of ways for you to stay on track, kind of, preserve your mental health, your physical health. And then we kind of just get ourselves together in a group and share our experience. Because this is a new course, I anticipate that we will be learning lots of things. We will find things that work very, very well. And I'm sure we will inevitably find some things that don't. So that's kind of why this course, for a 12-week course, $90 is actually a steal. That's like $30 a month. That's a steal, you guys. But because it's a new course, I want to make sure that, and we are still learning, I kind of want to make sure that you guys are getting value out of it. So I will also kind of elicit your feedback along the way as we go. So I'm really excited for that. Like I said, my goal is that by the time this launches by the time this podcast airs at the end of September, I'm hopeful that registration will actually be open. And if it is open, it'll be linked in the show notes below. If it is not open, be patient with me. It is coming very, very soon. I have a very hard deadline of no later than October 1st. Will it be open? Because registration is going to close again October 21st. So we're going to have kind of a narrow window there to get you guys registered. But definitely be on the lookout for that. So with that, we'll kind of, I guess that kind of that leads us into a little bit of what we're going to talk about today. So what I wanted to kind of talk about today is something that I unfortunately have seen a lot in the healthcare industry, but I've definitely heard a lot of my patients talk to me about, and that is this issue of weight stigma or weight bias. So if you're not familiar, weight stigma is basically kind of a bias or a stereotype of someone based solely on the size and shape of their body. So things like, people in larger bodies are lazy, people in larger bodies overeat, people in larger bodies don't eat vegetables, people in larger bodies don't care about their health or don't take their health seriously. None of those things are true, to be explicitly clear. But it definitely impacts, if providers have those types of biases, it impacts the care that people in larger bodies get. So if you are someone listening to this and you are in a larger body, I hope that you find that this is fairly validating. If you are someone who is not in a larger body, I still think it's honestly a value for you to listen to. Definitely if you're a provider. But if you're not a provider, I think it's still of value to hear that this is the experience that people in larger bodies go through. I think, in times like these, the world can just use more kindness and compassion overall. So I think that, anytime we can kind of start to understand each other's experiences just a little bit better, it just makes the world a better place. So to that end, definitely people in larger bodies are treated differently. We know that in society, but sadly, that is also very much the case in healthcare. And unfortunately, we have really strong data now to suggest that that actually negatively impacts their health. If you are interested on more research, I actually just heard a talk given by a woman named Rebecca Poole. It's Puhl. I will link her most recent study, which is a review article, in the show notes. But her whole line of research, I mean, she's basically dedicated her life to this. And she's just a wonderful speaker on the topic. So if you're really interested in kind of more data in terms of kind of how weight bias can impact actual like health outcomes, she's a great resource to go to. To that end, kind of, just a couple of snippets that I had from her talk, is just, the things that weight stigma adds to our lives, right? So one, it impacts the quality of care that you get. So I think that is probably anybody who lives in a larger body has probably gone to the doctor for something as simple as an earache. And if the doctor has not explicitly blamed your weight for the cause of whatever it is you're there for, including an earache, and that's not just a random example, I've actually like heard that more than once from patients. So if the doctor doesn't actively blame your weight for the reason why you were experiencing this earache, at the very least, they're going to talk to you about your weight while you're there for an earache, which is totally inappropriate, right? Like if you're there because you've got some type of sinus infection and an ear infection, like that's not the time to be talking to people about their weight. I've heard doctors talking to people in like, the ICU and things like that. And it's just like, this person just regained the ability to swallow. I don't think we need to be talking about like we're worried about getting enough nutrition in to support their lungs, which are failing. We do not need to be talking about weight loss at this moment in time. So definitely it impacts the care that you get. There's some kind of more indirect things that happen is that it certainly obviously increases psychological stress of the person who is being stigmatized, and I think the statistic that I've read most recently is that people who experience weight bias, whether it is internalized or externalized, and I want to I'll get to that difference in a minute, but if you experience weight stigma in any capacity, you are at least more than twice as likely to experience things like anxiety and depression. Um, to the difference of externalized weight stigma is things like I just mentioned with the earache, that you go to the doctor and the doctor's like, well, you're fat. That's why you have an earache. And it's like, well, are you sure it's not like an infection? Internalized is kind of you've kind of experienced stigma from society, kind of diet culture. We could go on for days of the other facets of life that where people experience weight stigma. Today, I want to focus solely on healthcare, but when you experience weight stigma, you are fearful of that weight stigma in a doctor's office. And that can either be based on a past experience, either like, with that provider, with a different provider, but it's basically kind of an internalized, like, I'm fat. That's why these things are happening. So that either makes you anxious, it makes you less inclined to go to the doctor, whether or not that provider is actually, exuding weight stigma. You have a fear of it, either based on a past experience or some kind of internalized, self stigmatization. So just a couple of other aspects that we talked about. One, it actually, you have you're not getting the same quality care. Two, we've got this psychosocial stress, which I don't think is particularly surprising to anybody. It also it worsens health outcomes. So it makes sense, right? Because if you are afraid you're going to be stigmatized, whether it's an internal or external, you are less likely to go to the doctor. Straight up, you're just less likely to go to the doctor. You're less likely to seek care because you don't trust that care is going to be of the same quality as it would be if you were in a smaller body, and to an extent rightfully so, right? Like we have good data that shows that it's not. So it just creates this vicious cycle. But when you have things like chronic conditions such as high blood pressure, heart disease, diabetes, etc., those things need pretty constant monitoring. And if you have one of those diseases but you're not going to the doctor regularly to check on it, those things are going to progress. They're going to go unmanaged, and your health outcomes ultimately are going to be poorer as a result. The other two kind of really big things that we notice is that it also, because of stigmatization, people in larger bodies are less likely to be physically active, again, because they're afraid of that shaming factor. So, a lot of times exercise would help, right? Whatever the condition is. And I don't want to spend too much time on weight loss just because that's not a key cornerstone of my practice. That said, exercise helps manage diabetes. Exercise helps manage high blood pressure. Exercise helps manage cardiovascular disease, independent of whether or not it helps with weight loss. That's a whole topic for a whole nother session. But, I think it's important to recognize that, movement is good for your body for pretty much any condition, even if the point of the movement isn't to lose weight. And even if you don't lose weight, just moving your body is beneficial. So I think we want to, kind of take some time to recognize that. However, because people in larger bodies are afraid of being shamed or made fun of, they are less likely to engage in those physical activities. It also can be uncomfortable to move a larger body in ways that it's not uncomfortable to move a smaller body. So a lot of times, exercise classes and things like that are not really geared for people in larger bodies, and a lot of times, fitness instructors don't, or even trainers, to be perfectly honest with you, don't have enough experience to give appropriate modifications for larger bodies. So sometimes it's a matter of, even if the modifications are there, the person in the larger body doesn't want to be the only person in the room doing a larger modification. That just brings a lot of attention to their weight, which is likely a shameful thing for them. Um, and then, a lot of times those modifications aren't even available. So it's kind of like, well, I can't do that because my body isn't the size that movement is meant for. But there's no alternative. So we're definitely less likely to engage in physical activity. And then there's actually a significant amount of research that comes out that people in larger bodies who experience weight stigma are actually far more inclined to actually binge eat. So weight stigma actually leads to weight gain. That was kind of some newer data that came out of, like I said, Rebecca Poole's work, which again, she's just phenomenal. Cannot recommend her enough. So it's really important to kind of, notice all of those things. So, worse worse quality care, psychosocial stress, more likely to binge or comfort eat, more likely to gain weight, less likely to lose weight. Those two are kind of the same, less likely to be active. And it actually worsens, because of all those reasons, it worsens health outcomes. So independent of weight, which I think is super important to know. And when I say independent of weight, I mean all independent of weight changes. So basically, health outcomes are getting worse whether or not that person is gaining weight, and health outcomes are getting worse regardless of how overweight or how obese that person is. Completely independent effect. Weight stigma just worsens health outcomes all on its own, which is scary. It's really, really scary. And if you are a provider listening to this, I really encourage you to kind of take a minute here and pause. And kind of, reflect on some of the times and some of the ways, because I mean, I'm sure you have patients who are overweight and obese. And what are some times that you maybe have mentioned their weight in relation to a disease when they didn't ask for you for that? It's one thing if a patient comes in and says, hey, I really want to lose weight. What can I do? Then that's an appropriate time to mention their weight and to kind of walk through some strategies with them. But if they didn't bring it up, um, even things like knee pain, arthritis, diabetes, etc., you may be, just because there is data to show that weight is associated with those conditions. Yeah, absolutely. You can mention weight, but I always ask for permission first. And because honestly, that person may not be interested. They may have, they've been through this cycle before. You are not, I don't care who you are to this person, you are not the first person who has told them that they are overweight. They know. And I guarantee you that they have tried more than once to lose weight. And because they are still standing you in front of you in a larger body, they have not done that successfully. And I guarantee you they carry an intense amount of shame because of that. They shouldn't. And that's a whole different topic for a whole different day. But again, they know. And it's not that they don't care. And it's not that they're lazy. And it's not that they don't recognize that their weight may or may not be impacting their health. It's simply that they've tried and nothing has worked. And again, the reasons for that are a whole different topic for a whole different day. But intentional weight loss is not something that is appropriate for all people, period, hard stop. I don't care what their health conditions are. You can improve your health without making your body smaller. And all of your patients can too, if you're a provider. So if you are a provider, I strongly encourage you to consider not mentioning weight unless your patient brings it up first. Or if you do, feel as though you must bring up their weight, ask for permission. Ask for permission first. Um, So that's kind of my little soapbox to providers. Now, to those of you who are patients, right? I want to kind of empower you to just with the knowledge of kind of what your rights as a patient are, because I think unfortunately in this country we have a very authoritative healthcare system. It is not kind of a collaborative approach like it is in many other places where the provider comes in with obviously knowledge and expertise of medical science, but they still respect the fact that you are the patient. You are seeking their advice, but in the same way you're seeking your accountant's advice on your taxes, right? Your accountant is going to sit down, explain to you your options, and kind of go, you collectively decide. It is ultimately your decision, right? You tell the accountant what to do at the end of the day. That is how healthcare does work in other places, and frankly, how I think it should work here, but it doesn't. It very much tends to work in a more authoritative way where the doctor comes in with the expertise and the knowledge and basically tells the patient what to do. Um, that is ineffective. Again, there is a whole body of research that supports that. And we could be here all day talking about just that alone. But I think because it is that way, a lot of times patients feel very helpless. And that's where we get these avoidant behaviors, such as, not going to the doctor's office, not getting blood drawn, not seeking help care when something is wrong. And then we have these poor outcomes. So if I teach you nothing else, we can't change the whole system in one day, right? But we can empower you to know what you actually have the right to do and not to. And always, if you feel like you are being stigmatized, this kind of, it should go without saying, but I will say it anyway. um it You have the right to fire your doctor or provider of whatever sort. If you feel like you are not getting adequate care, you have the right to on the spot fire that provider, walk out, and refuse to pay. You also have the right to say, I don't believe your opinion. Is there another I don't like the way you're speaking to me, whatever it is. Say, I don't appreciate this. Please bring a different provider in to see me today, right now. You have those rights. They may not be able to accommodate it. So they may say, well, I can't have someone come see you right now, but we can get you scheduled with a different provider. And you should not be billed for that visit, straight up. It is, there are certain situations where you may have to fight for malpractice to kind of cover that, but you do not have to see a provider or not have to, heed the advice of a provider that you do not feel treated you appropriately. Um, Other things that kind of simpler, less aggressive options. You also have the right to not be weighed. There are certain situations where they may need your weight. So things like surgeries, anytime you're going to be like sedated, stuff like that. A lot of times those medications are calculated on the basis of weight, and it's not, a stigmatizing thing. It's just like in order to give you the right dose of medication, they need to know your weight. So there are a few exceptions, but you certainly have the right to ask and say like, hey, is this super necessary? Like, do I have to get on the scale? For a lot of people, just getting on the scale alone, knowing that somebody else is seeing that number, having to see that number themselves, it's very stressful, and you don't have to go through that. There may be sometimes, like I said, with certain medications and things like that. Even in some kind of primary care settings, like, well, we really need to wait every so often, things like that. You don't have to see that wait. They may require that you are weighed. They should accept that, like, hey, I don't want to be weighed. I just don't. But in the instance that they do truly need your weight, you are first of all entitled to ask them, hey, is this really medically necessary? And if so, why? Somebody should be able to give you an explanation as to why they need your weight so badly. And if let's say they do, that they genuinely need it, you're going to have surgery. They want to make sure that they're not overdosing you on anesthesia. That's okay. But you don't have to see that weight, and you don't have to hear that weight. And that weight does not need to be announced in any kind of public forum. It should never be announced by anything anyway. But so you have the right to stand on the scale backwards and let them adjust your weight. You have the right to ask them, hey, can you like write that down on a piece of paper? Don't tell me what it is. You have the right. They may or may not be able to avoid putting it in your medical chart. I know now with a lot of the EMR systems, like they have apps that link to your account. So sometimes it's kind of like if you have one of those accounts, you're going to see your weight anyway, but you definitely don't have to see it like right then and there. kind of on the spot, so to speak. Um, and then you can ask your provider not to discuss that weight. Even if you have no problem kind of providing a weight, be like, yeah, okay, whatever. Like, I don't care to step on a scale. For me, that's not stressful, but I don't want to talk about it. Right. You have a right to tell your provider that. Your provider, as I just said, should ask you, hey, can we talk about your weight? And you have every right to say no. A lot of providers aren't going to ask, unfortunately. So you have the right to say, hey, stop right there, doc. I don't want to hear it. I don't want to talk about my weight, period. We have, I'm sure, a laundry list of other things to talk about. That is just not something I'm interested in discussing today. And they have to be respectful of that. They just do. Um, that's, that's part of their training too. Um, and you have, and then, like I said, if you um experience the instance where you feel as though they are blaming something for your weight, which is either unrelated to your weight, such as an ear infection, or it's something, maybe like knee pain that is, maybe your weight is exacerbating that condition. However, there's likely another, like, not everybody who is overweight has knee pain, so there's something else going on with your knee specifically, and the doctor needs to address that. And I keep saying doctor, and I really mean medical provider. It could be a doctor, it could be a PA, nurse practitioner, naturopath, anything. So basically, if your doctor is telling you like, hey, this is just because of your weight, you have a right to argue and be like, okay, if I were skinny, what would be your answer? What would be your answer? Because not everybody that's this size has this problem. So it's not just my weight. What else you got? And they should be able to answer that question. And if they cannot, that's when I would walk out. Um, that's when I would say, like, I'm not paying for this visit. Do not bill me. If you do, I will sue you for malpractice. And then you have to back that up, and that sucks. But that is malpractice at that point. So make sure that if you are in that situation, that everything is documented, etc. But it's super important to know that you have a right to hear alternative explanations. The doctor said, well, it could also be this, that there should be something else other than just your weight. There's nothing on this planet that is just the result of your weight. I promise you that, because there is not a single disease that affects just fat people and not skinny people too. So I don't buy it. That's trash garbage. It's a lazy excuse. Even if your weight is a factor, it is not the only factor, and you are entitled to have a full, explanation as to what's going on with your body. You also, again, that's kind of what gets into this poor outcomes. We don't want to miss something simply because of we're assuming, oh, well, just because you're overweight. Like that's not the case. So those are kind of my little tips for you guys to take home. Again, if you have experienced this, I personally have not, but if you have experienced this, then I am truly sorry that has been your experience. I think it's super important to kind of, find providers that you can trust, who do not carry weight stigma. So I think it's just something, honestly, that we need to kind of talk about. And even as, providers, we need to kind of continually check ourselves on. So that is it for today's episode. Like I said in the beginning, we will be launching, hopefully by the time this posts, we will have open registration for our holiday support group. Like I said, we're going to get into all kinds of good, delicious things there. I will post the link for it below once we kind of have all the details together. And I hope to see you guys there. Have a wonderful rest of your week, and I will see you next time.